Thank you. 1 in 8 people in India lack access to clean drinking water. 75% of the disease in India is due to waterborne contaminants. We need a solution for this. In India, you have these massive, complicated, industrial-sized, centralized water treatment plants that are basically having to ship water across the entire country to over 500,000 villages. These are the same pipes that corrode, crack, and get contaminated by diseases like cholera and typhoid, disease that we don't even have to worry about anymore. So we at Sarvajal decided to tackle this problem. Sarvajal means clean drinking water for all. And we decided to tackle this problem by putting a machine, like the same type of machine that you saw earlier, but taking out all the bells and whistles, putting in, making it a little bit smaller so it fits the village. And can we go back a little bit? 1, 2, yeah, there we go. So what we wanted to do is we decided to compress this machine, make it a little bit smaller, make it small enough for a village size so we can actually filter the water for that village community. And we decided to pair that with this same machine with a franchisee, or sorry, a water entrepreneur, someone who's actually working with the community, someone who we actually engage to say, okay, if you are selling more water, that will provide a better and stronger livelihood for you. And that water entrepreneur started engaging their community. And they started making sure that that their community understood that this clean water is going to improve their lives. And this is usually where the story ends. Large organization comes in, provides infrastructure, everyone's kind of happy, hunky-dory. Sometimes you see things going on where it will kind of continue, or other times you see it kind of failing and degrading away. But we actually saw something actually pretty special happen here. Within a couple of months, people started lining up, not to get a handout of clean drinking water, but to actually pay for clean drinking water. Not only were they willing to pay for drinking water, but even a few months after that, they were willing to pay a premium on top of that to actually get clean drinking water at their doorstep. This is pretty cool. We have the clean, convenient drinking water, and people are willing to pay for it. And here we are in this village called Bugger, a small village which people are getting kidney stones because of the mineral content in their water, and people are actually saying, hey, I actually want to get clean drinking water for myself. So we said, let's take this water entrepreneur, let's turn him into a franchisee, and let's have that franchisee start to earn a profit. And we start to collect some revenue with that share so we can start to build another village where they're also learning to get more water to their family and their community. And so what started to end up happening is that we started to scale. And as we started to scale, we started seeing issues with making sure that the water was clean in every single one of our locations, making sure that the franchisees were reporting the correct information to us, making sure the machines were running effectively and properly. So we decided to answer those issues of quantity, quality, and machine health through technology. We installed a microcomputer on each of these franchise-operated water treatment plants. And each of these franchise-operated water treatment plants are able to now actually record that quality and quantity. And so if something is not operating within those thresholds, so say, for example, water quality, we can actually stop the machine to make sure that we're getting enterprise-level services within that community. We then started pairing that microcomputer with a cell phone or a GSM modem, so we can actually get that data at our actual offices or anywhere in the world easily and accessibly. So we started to see how much water are we actually selling in each and every one of these locations, and actually see what the water quality is in each and every one of these locations, so I can see what Village A is doing and Village B is doing, and learn from Village A about the social impact I'm having in Village A to improve other villages. So we're lifting all boats, improving our social impact over time. So we've built this highly effective, highly efficient business model that is providing enterprise-class service to the rural communities. And I wanted to come here today to give you this little report. We started this project 3 years ago. in 2008 in one village. And today, 3 years later, we're in over 130 villages, providing clean water to over 70,000 people each and every day. Let me do that. So, thank you.